If you are over 60, how many times do you think that you'll be able to stand up from the chair in 30 seconds without using your hand? 10 times? 15? 20? And if you can do that only for 5 to 10 times, does that mean that your legs are weak? Actually, there is not one number that people over the age of 60 can do in a minute or 30 seconds. It's a variable. Your age matters, your sex matters, the kind of chair that you're sitting on, it matters. So there are different factors which are responsible for your ability to stand up from the chair, from your sitting position without using your hands. This is called a 30-second chair stand test, and clinicians use it to assess lower body weakness and your stamina and endurance. So here's how the test works. Use a firm chair without armrest, with a straight back, and the height of the chair should be at least 17 inches. Sit with your feet straight on the ground and your arms like this across your chest. When the timer starts, stand upright completely and then sit. That is 1 rep. Then again stand up, sit, that is 2 steps. So start the counter up to 30 seconds. Try to count the number of times that you can stand up from the chair unassisted and then sit down. However, if you feel unsafe, if you got dizziness or ataxia, then don't do this test. Once you have your number, don't compare that to a universal number. Everything is variable. You can have different numbers at different times, but we have to look in totality how your endurance exists and how your strength lies. For example, the expected reference for somebody who is 80 years old is different than that of a person who is 75 years of age. So you compare yourself with the person of your same age so that you can get a universal target. And if your score is below that reference, then of course that means that you have to do something with your body. However, if you fail to achieve a good number, that does not make you a sick person, that does not diagnose anything, and also that does not tell you about your biological age. A low result simply means that you have got weakness in your lower limbs and your endurance is low, and that you have to work on the principles to gain strength and endurance in your lower limbs. Why is this test important when it does not denote any disease? Also, it tells you that you don't have any disease of the central nervous system or the peripheral nervous system. It makes you look good and happy. The goal of this test is to maintain the strength and endurance in your activities of daily living, or ADL. So it tells you about your QOL, or quality of life index. In other words, this test also gives you an idea about your mobility status, about your fitness status. If that is low, you need to work on that. If that is good, feel happy and look happy about it. The next question, can you balance yourself on one leg for 10 seconds? To find out the answer, watch my next video in which I'm going to describe you about standing up on one leg for 10 seconds.